Hello everyone and welcome to Step It Up with Dr. A, where we share stories, lessons, and insights to help students, professionals, and lifelong learners navigate their personal and professional journeys. Before we begin, I'd like to share a quick note. The purpose of this podcast is to educate, inspire, and encourage thoughtful decision making. The experiences, opinions, and perspectives shared by me and any guest are based on our personal and professional experiences and are intended for educational and informational purposes only. They are not intended to serve as individualized medical, financial, or professional advice, career counseling, legal advice, or academic guidance. Every person's journey is unique. My hope is that these conversations help you ask better questions, explore possibilities, and make informed decisions that are right for you. Please seek guidance from qualified professionals and mentors when making important decisions. Hello everyone, I'm Dr. Nivedita Agarwal and welcome back to Step It Up with Dr. A. If you're joining us for the first time, this podcast is dedicated to helping high school students, pre-med students, medical trainees, and young physicians navigating their journey into medicine with greater clarity and purpose. Joining us today is Dr. Adam Weinstein, Professor of Medical Sciences and Pediatrics at the Frank H. Netter School of Medicine at Quinnipiac University. Dr. Weinstein is a pediatric nephrologist, medical educator, assistant dean for clinical curriculum, career advisor, and award-winning professor who has spent much of the career mentoring students. Dr. Weinstein, thank you for joining me today. So let's start from the beginning. Every physician has a unique story. Did you always know you wanted to become a physician?
I think it was always on my thought process growing up. I was very interested in science. I was very interested in relationships and working with people. And even if you ask me when I was a 4 or 5-year-old, what do you want to be when you grow up? I would say I want to be an elephant doctor. That's not a human doctor, but it was on my brain, being a physician of some type. And as I got older, it remained on the forefront of my mind. I think it solidified when I was in high school when my grandfather got sick, and he lived with us. He ended up having cancer of the kidney with some metastasis, and I saw firsthand the team approach that he was receiving, the care he was receiving, and it really solidified my interest. That interest, yeah.
Sorry to hear about your grandfather.
Thank you.
But there was an experience that led you to it.
Yes. With some, it was always sort of in my mind.
In your mind.
I enjoyed that, and then I was seeing it. I was fortunate to be fairly healthy as a child, and so I never really saw the healthcare system in depth, other than health maintenance and minor ailments.
Of course.
So seeing that, I really saw the potential and what could be involved in being a physician. So I think that really made me enter my undergraduate years really more seriously thinking about pursuing it.
Got it. So did you have any mentors in high school or college that guided you or helped you through navigating this career?
Yeah, I think there wasn't necessarily one person. My grandfather himself, certainly, he lived with us for the last couple years of his life, and he, I would see as a mentor, whether he knew it or not. He was definitely a really important influence. In college, a friend of the family invited me to work with him and shadow and observe him. He was an allergy immunologist, and so I was able to, especially in my undergraduate years, shadow and see what his practice was like. And he was another mentor. I think a lot of my mentors weren't necessarily physicians, though.
Okay.
And just seeing how they went about their life and how they went about, they saw my interests and supported me and helped connect me through the right pathways.
Got it. Wow, very nice. Where did you attend medical school?
Yeah, so I went to medical school at Cornell. It had just when I applied, it was Cornell University Medical School or Center. I forget the name, but it changed to the Weill Medical College that it's called now. While I was there, it's right in New York City.
And what was the reason you chose that particular medical school?
Yeah, a number of reasons. Probably the biggest reason was the culture. I mean, it's in physicians. As physicians, we're clinician scientists. There's a lot of science, a lot of objectivity that goes into our work, and so I think there's a tendency to want to have very concrete and tangible reasons why you make a decision, an important decision like that. But on my interview day and in the tours and just I felt at home. The people, like the students that I interacted with, that led the tours, and I was fortunate to be interviewed by a fourth-year medical student, so I learned a lot from that person. It just felt right. So I want to say, like, sometimes there's something about the gut feeling, even though we don't fully understand what it's about. There is a basis, and the brain is, whether I'm conscious of what's going on there or not, it was telling me this place felt right, and I think that's what the gut was doing. So there was a lot of that, but other aspects, so some more of the more objective, tangible things that attracted me. It was a new curriculum at the time, and it was very case-based and active learning. It wasn't just sort of sit down in a lecture learning. So much of the day was really working in small groups with classmates and faculty, and that excited me. It was in New York City. I grew up in Westchester, near New York City, and that was my city, and so I was excited to, I knew I wasn't going to live in a city. That wasn't my aspiration. I wanted to live outside of the city, but I wanted to experience what it would be like living in the city. And so, of course, New York City was where I wanted to be. And at the time, my father actually lived just 4 or 5 blocks away from the medical school. So I think when you go to college, you want to go away from your family. Like, it's not that you want to go away from your family, but you want to have some independence and see what it's like. So I purposefully went to college, not right around where I grew up and my parents, but then in medical school, it was really nice to be near someone where you could be supported and have a nice proper dinner if you needed one.
Of course, having family close by, so you have the best of the both worlds.
And at the same time, my brother ended up moving 20 blocks away in New York City. So it was really, really a good fit for personal reasons. The curriculum was exciting. I'm very innovative. I like to try new things. So having it be new and be innovative was very exciting to me. And then I just felt good there when I was there, and so it all connected. So I was excited to be able to go there.
That's amazing. So you actually had a good curriculum over there. You had case-based learning, and you were in the city, in the heart of the city, and you had family close by.
Yeah.
So you were able to fully explore and enjoy everything about grad school, medical school.
Yes.
How was this experience different from undergrad? Can you elaborate on that?
Yeah. I think medical school, you needed to stay on top of things. it moved fast. So undergrad, you took a course for a semester or a trimester, depending on where you go, and you can kind of like go along with it and really study at the end of the course and make sure you're ready for your exam. In medical school, that doesn't really work as well, and you really need to keep up and stay on top of what you're learning that week, and not put things off, because if you fall behind, there's just not enough time to catch up. It's very integrative too. So if you're not keeping up all the class time, if you're behind, you're not getting as much out of the class time because you're lost. You haven't learned what you needed to learn the previous week in order to be able to participate and really get the most out of the activities of the current week. So I think the most important thing is to be very structured and planned with your study, and create your own study schedule and study plan each week, and don't sort of, it's the start of a new block, I can just sort of hang out and coast for a couple of weeks, and then the last couple of weeks of the block really study. That's not going to work, because you're not going to be able to get as much out of it. So really each week have a study plan and figure out your schedule so that you can stay current. That doesn't mean you have to study from 7 a.m. to 11 p.m. every day, right? You can build in your time to go for a jog or do music or go to a show or whatever you like to do. That's important to build into your schedule,
of course,
too, and service activities, or if you like volunteering, if you like research, you can build those into your study schedule too.
So having a structured reading, structured time for studying and for doing other activities, having that consistency is very important.
Yeah, I think so. I think in undergrad, you can do that too. But in undergrad, I think you can coast for a few weeks and then catch up.
Right.
Whereas in medical school, I think it's much more important to stay
on track.
Stay on track, because then you're not going to get as much out of it, and then you'll be behind, and maybe bring in the possibility that you may struggle. You want to avoid that possibility. If you're keeping up, then you're going to do fine.
That's a very practical advice.
Yeah.
If you could look back, is there anything you would have changed differently in undergrad years to help you better prepare for medical school?
That's a good question, and to be honest, I haven't actually really thought of that question before. I think I really I lucked out in that I prepared myself. I think I went in and I was good. I was ready. I felt confident. I know that's not the case for everyone. So I think maybe my mentors, maybe my approach put things together. So what was my approach that I feel good about? I took a wide variety of classes. So I did a lot of the science, which some of which is required to apply to med school. So I did that, and I majored in molecular biology. So I was deep into that. But I also took music, and I also just took classes I took a geology class, and I took a environmental science class, and I think taking those classes that are outside the blocks were really nice. I feel getting that depth of science, but also taking classes in other fields was very enriching. And what it did was it got me to really develop a thought process and reflect and ask why, and really get to the bottom of things and in each of those different areas. And I think that approach to really try to understand things and not just sort of accept, okay, that's how it is.
Right.
really developing an approach to really try to understand things and ask, why is this that way? Or why does this person think this way? Or why do they choose to write it that way? Whatever field it is, I think that breadth of learning helped me be prepared for medical school and gave me insights into how to learn the clinical science, and also insights and a breadth of topics that I could use to communicate with a variety of individuals. I think another important thing that I did in undergrad was get involved. I did a lot of service work and volunteered for local organizations and individuals who needed support. I did a lot of teaching, and so it was sort of a prelude to so I taught a lot of, when I was a junior or senior, I would be a teaching assistant for the freshmen and sophomores. And so it was a prelude to my future career as an educator, I guess. But I did a lot of volunteer work with the community, a lot of volunteer work with the school. And I think that work was very, very important. I did a lot of music. So I performed in various groups. And that gave me fuel and resilience as well. And again, just ways to express myself. And if I had a tough day, I could get it out through those sorts of activities. So I think that combination of those combinations can really help someone be ready. And a lot of people enter med school feeling like they might be, am I really here? Do I really belong? How did I get in? There's all these other people that are so accomplished, but just know that if you're in med school, you belong there. The admissions committee sees a lot of amazing individuals, and it's very hard for them to choose amongst all these amazing individuals. And so if they chose they chose you for a reason. So even if you are different than this person, or didn't do this or didn't do that the way some other person did, you did what you did and have shown that you belong. So I think you don't have to necessarily do what I did, but I think doing a broad, getting good education in a broad array of fields and participating. Medical schools are looking not just for people who do classwork well, but they're looking for people who contribute to the community around them. So whether that's doing service, whether that's teaching or volunteering for the school, whether that's doing research, whether that's doing varsity athletics, all of those things show that you're contributing to your community in some way, and are very important and looked on very favorably.
Sometimes undergrad students get very overwhelmed, and they try to do everything. They try to do volunteer work. They try to do research. They try to do teaching assistant positions, like you just mentioned.
Yes. Yeah.
So they try to do every single thing now because they feel that if they don't, they may be missing out, or their application won't be considered. How can you help with that?
Yeah, that's a great question. And to be honest, medical students too, they come to medical school and they try to do everything,
right,
even while they're medical students. So yeah, I'm so glad you asked that, because my previous answer was I got to do all these things.
Right.
I think do one or two of those things really well is better than trying to do everything a little bit. And so if you are a varsity athlete and that's what you do, and maybe you do one other thing, and don't forget, you've got to do your classwork. Like I said, it's important to do more than just your classwork, but you also have to be able to do your classwork.
Yes.
So first and foremost, really attending to your classwork and learning and showing your depth and breadth to learn your classwork is really good. That's primary. And then pick two or three things, maybe one thing if it's really involved, but that you really enjoy. And I think it's also important to pick things that you enjoy, that you're passionate about.
Right.
Because hopefully you do get interviews for medical school, if they ask you, like maybe the interviewer will ask you, tell me about your research work with that. And if you aren't passionate about it, they can see
Of course.
that. And so it's really important not just to try to do everything to fill out your CV or your resume, but rather pick the things that you love and that you enjoy and that you're doing because you care about them. And if you do, for me, I love teaching. So I did a lot of that, and I love music. And so I did a lot of that. Those were probably my two biggest things. And so when I was asked about those two things, I could speak very passionately about and very, in a way that showed my depth and showed that that this really is what I'm about. And so pick those things that you care about and do them well. And that's more important than trying to do 7 or 8 different things.
Thank you. That's an excellent view and suggestion and advice. A lot of our audience who's listening to the show today or viewing the show today, a lot of them are pre-med students or high school students who have just started their journey, and whether it's SATs, MCATs, PSATs. What is your advice on how to study for these exams? What are some study strategies you suggest? As we all know, we have to go through so many standardized exams, and these exams are kind of limiting paths for us, right? As we navigate our journey to undergrad or 8-year program or medical school. What are your suggestions how to navigate this?
Yeah, I think I would say something similar to how I talked about how to approach your day-to-day in medical school and have a schedule, have a structure. So if you're studying for the MCATs, there's different sections in the MCATs, and make sure that you're approaching each one with a plan. And that could be a plan that's partially self-developed. It could be a plan that's developed with a mentor. It could be a plan that's developed with a paid tutor. It could be a plan that a course helps you develop. There's no one right way to do it, but I think the most important thing is to really have a schedule and make sure you're thorough in covering things. One pitfall I sometimes see people do is they just do a lot of practice questions. And it's the analogy I use, like if you're just doing practice questions without like a schedule and a thorough plan, you might be just shooting arrows, and each arrow hits, but you're not seeing the whole target. You're just seeing the spot that you hit. Whereas if you create a schedule and a calendar and a study plan that's thorough, that's based on the full content and the material, then you'll see the whole target. And then once you have the target in view, then you can shoot your arrows. So really come up with a plan, and as you're doing the plan, do some practice questions. That's an important part of the study plan, but it's not the only part of the study plan. So with any of those tests, whether it's the MCATs, whether it's the USMLE, I think, or just whether it's your med school coursework, I think having a schedule and a study plan, it can help you really be successful with it.
So consistency once again, right?
And planning. And being flexible too. I tell students that I work with, that, like in their 3rd year, they're on their surgery rotation, and make a study plan. You need to study surgery while you're on your students. So each night have a plan what you're going to do. You're going to read an hour about your patient, some questions. You're going to read from a review book to make sure you're learning the thorough, full content of surgery. But I also tell them to be flexible. If you had a really tough day and a busy day, give yourself that night off to heal yourself and rejuvenate and adjust your, don't do that for 2 weeks in a row.
Right.
But if you need to, treat yourself too, so that you can come back to it the next day too.
Okay.
So it's not, the study schedule is in pencil. It's not in stone.
Yes. You have to be flexible.
Yeah.
So, Dr. Weinstein, you have not only practiced medicine, but you have also spent years advising students, mentoring and teaching students, making them future physicians. This gives you a very unique perspective that very few physicians may have. Looking back over all the years, can you tell fairly early which students are likely to thrive in medicine? And if so, what habits or qualities do they consistently demonstrate?
Mm-hmm. That's a really great question. And thank you for the really kind introduction to that question. I think part of it is the relationships that they want to build. So if I see because being a physician isn't just about doing well on a test. And it's sort of a little bit, I don't know if irony is the right word, but like you have to do well on these multiple choice tests. But when you're with a patient, it's not like you see the patient and then there's a multiple choice question for you. It's different. It's totally different, the practice. And I think what's really important to the practice of medicine is the relationships, the engagement, the learning and the listening with the patients and from the patients. And so one aspect of a very the type of student that I would say, oh, this person's going to be super good, is when I see that sort of relationship-centered approach to their learning and their work, whether it's classroom work or whether it's clinical work. And so if I see a student that really cares about the relationships they're building with their colleagues, with their patients, and they're listening and they're learning and they're growing, that's a student that I'm like, ooh, this person's going to be a really great physician. So it's more often that I'm able to see early, like more about how their relationship building and their engagement and the way they care is so essential to being a physician. Learning, like if you're in medical school, you've already proven you can learn the knowledge, and it's more about building those relationship skills.
Do you feel that when an undergrad student is applying to medical school, can the admitting committee, can they see that aspect of a student?
Yeah. And I'll preface that I'm not on the admissions committee, so I can't say for 100% how they do it where I work, but I think physicians have spent years meeting patients for visits, and they quickly, within a matter of less than an hour, depending on how long, what type of visitation, your visits might be 15 minutes, they might be half an hour, but they're able to very quickly figure out what's going on. And so a physician has learned to develop very profound insight into the data that they're receiving, whether it's on the history, the interview questions, whether it's the physical exam, but they're piecing it all together and creating an interpretation. So I think medical school admissions committee in particular, they meet a very talented individual, and they can immediately see just through the conversations, is this person have those relationship skills? Does this person have the listening skills? Does this person show the care? It's not necessarily care of another person that they're looking for, but care of their work. Like, you did this research project. When they're asked questions about their research project, does that applicant show that they the care about that project, the care about their team. If they're on a sport, they're playing varsity basketball or varsity lacrosse, whatever. Do they show the care about their team, the care about the work, the care about the training that was involved, the care about the growth and the learning that was involved to be a varsity athlete, a musician, an artist, whatever it is, a service activity. If they're able to speak with care, and that's what I was talking about with passion before.
Yes.
I think the admissions, the physicians on the admissions committee can see if someone's speaking about those activities and those life experiences with care and passion and the ability to form relationships and listen about it. They can see that, and that's what they're looking for more than the activity itself. And so it could be the same. You could have two students do the same thing, and one speaks profoundly and with a lot of passion and knowledge and insight and growth about it, and the other one just speaks a little bit nonchalantly about it. It could be the same thing, and it makes a big difference.
So having a passion.
Yeah.
Having a passion with whatever activity that they're doing or pursuing.
Yeah.
That's incredible.
And in the interview too, or in the application, really getting that to show will make them stand out rather than the activity itself.
Well, that's such an excellent guide and advice and something to be aware of, right?
Yeah.
As a student, that whatever you do it with your heart.
Yes, and because you love it. And the other thing too is different medical schools are valued sort of different things too. So when you asked me about why I appreciated where I went to school and it was a good culture fit, the medical schools are looking for applicants that fit their culture too, so they can kind of get a sense, this person's approach or the way this person navigated this question or this answer or this experience really fits with our culture, with our environment. And that might be the case at one school, and not another school might have a different approach. And so I think it ends up being, it usually is somewhat mutual. Mm-hmm. You sort of leave one place, you're like, I'm feeling really good about, I had such a good time. If you had a good time visiting that place or interviewing at that place, and then they probably did too. Whereas if you learn I didn't really connect very well, it didn't connect with me very well, then it might go that way, because every place has its own culture, which I realize as I'm talking about it is a little harder nowadays because a lot of interviews are virtual in the first pass, whereas long ago it was in person. Yeah. But you can still learn a lot about the culture of a place virtually by the way, again, it's the way someone listens, the way someone answers questions, the way they understand a question, the way they interact with others, the values that they express. You can really get a sense of what working at this place or learning at this place is like. And then if you're interested in a place, you do have opportunities later down in the season to visit it and confirm that it's what you thought it was. So,
a lot of medical schools offer summer programs prior to coming in or prior to even applying. What kind of programs, if a student has an opportunity to pursue, should they pursue?
I'm going to go back to only if that's what they want to do. So I think if you look at a medical school class, the minority did a program. So if you want to do global work for your summer, or you want to work in a lab, or if you want to do some quality improvement project with a practice that you've had some mentorship with. Whatever it is, do that. Do what excites you in that summer. Whatever it is, if it excites you and if it's meaningful work, it'll again be a help to you, both for your application, but also just to you, because it'll grow you, and you'll be doing something you care about, and you're going to learn from, and you're going to be a different person, not a whole new person, but it's going to shape you.
Of course.
The way all experiences shape people. So my first answer would be to do what you love. And the benefit, I think, of doing some of the programs are that you really learn approaches to medicine and get if you don't have those connections already and you're looking for new ones, or you're looking for new ones, you can get those through programs like that and develop a new mentor or develop a new opportunity path to pursue, I think.
Excellent. So Dr. Weinstein, you are a pediatrician. What made you decide to go into to do pediatrics?
Yes. So as I was going through medical school, to be honest, I was just like I mentioned growing up, I wanted to be an elephant doctor. So medicine was always in my mind. As I was going through medical school, pediatrics was on the back of my mind, but I wanted to approach all of the rotations and the experiences with an open mind. I didn't want to, put myself in a box. And as I was doing my rotations, actually one of my favorite rotations was internal medicine. And I loved thinking about solving the problems. The illnesses that patients get have a pathophysiology behind them, and that's the disease process. And I really enjoyed understanding that process, figuring out what was wrong with the patient, and then coming up with a solution to help that patient. And I found that I was equally excited by sharing that solution and engaging the patients in the solution. And in pediatrics, yes, the patient is the child, and if the child is 2, they're not going to understand a discussion of pathophysiology, but the parents are so engaged. And my finding in pediatrics was that the parents cared so much about their child; they wanted to learn how to help them, and having these individuals as part of the care team was very inspiring for me. And I loved teaching them. I loved sharing just seeing their relief when they understood what was going on and knew what to do. Because before they understood, they were just terrified and scared of what's going on. And being able to help them with that relief and then engage them and give them something to do to care for their child. I found that the most satisfying relationship. And that was, I could do part of that in adult medicine. But there wasn't the same level of relief. Like, the patient was happy to know what was going on, but it wasn't that same intense relief. And that same intense relief, I think, draws some people away. It's very intense, but I just was inspired by that and found that dynamic something that I really sought and thrived with. So, and I went into a pediatric specialty, I think, because in general pediatrics, I actually started thinking about general pediatrics too as I started my pediatric training, because I really enjoyed those relationships with the family and that longitudinal relationship you can build and support the family with. But general pediatrics is, most of your work is health promotion and safety counseling and really supporting that child to grow up in as healthy a way as possible, which is very important. However, it didn't involve the disease process and the pathophysiology. I mean, it does. Pediatricians take care of disease too, but more of their work is health promotion and keeping kids healthy and giving them good habits to be healthy as adults. And if I went into general pediatrics, I wanted more of the solving, figuring out what the problem was, really the complexity of problem solving. And so going into a pediatric specialty gave me sort of the best of both worlds that I loved. It gave me that relationship dynamic where I could take care of a child and work with the parents and share with the parents. Working with the children was also fun. If you asked any of my friends growing up, like they knew I was going to be a pediatrician because I did tutoring, I did summer camp counselor for 5-year-olds. It's like I was always working with kids, and but it brought that dynamic with the more consistent. I don't want to say it's general pediatrics certainly has that level of complexity, but more consistent involvement of thinking through a disease process and trying to understand what's going on. Why is this child experiencing this combination of symptoms and findings, and then working on a solution with the parents. I liked that aspect of the care as well.
So parent engagement, working with children, learning more about in-depth and teaching more in-depth to both, mainly to the parents.
Yeah, and certainly when the child was old enough, they would be engaged. I think another interesting dynamic is that the children grow up, and so they change over time. And that includes the diseases that they get changes over time. And the way you engage the child and understanding the care that they need changes over time too. And in infants and toddlers, you're not making too many attempts to help the child understand what's going on. You're really attempting to make them comfortable and feel safe with what's going on. But then by the time they're teenagers, it's so important that they understand exactly what's going on, just like the parents. And you give them that opportunity to participate in the decisions and to teach back so that they understand. They demonstrate that they understand so that when they become adults, they're ready to continue taking care of themselves.
Especially when they are living through that illness their entire life, maybe for a short period of time, depending on what the illness is.
Yeah, absolutely.
And also that's very important to engage children.
Yeah. And then in between, there's, I went from babies to teenagers, but throughout the spectrum, you're stepping it up. So when they're 8, you're not going quite to the same depth as a teenager.
Right.
However, you do want to make sure they have some understanding of why they need to do this. And so you have to really understand the developmental progression and engage them in a developmentally appropriate way. So that is also a really enjoyable part of being a pediatrician.
Amazing. Throughout your career, you have cared for patients who while also training for future physicians. What do you think patients remember most about their doctors?
Yeah, this is something I have talked about on the first day of medical school, or the first week. There's a class that me and a couple colleagues will teach to the first year students about opening a visit and starting to use some patient-centered communication techniques. And what we share during that class is that if you ask a patient who a good doctor is, like tell us about a doctor that you think was outstanding, they're not gonna they never say, oh, this doctor was so outstanding because they got 98% on their biochemistry test or their MCAT or whatever. That's not what the patients will say. The patients will say, this doctor was so amazing because they sat down and listened and spent time with me and made sure I understood. And so it's all about the communication and being patient-centered. And so that's why the whole first week and even the first month of medical school is so focused on instilling those techniques right from the get-go, so that then the rest of the 4 years of medical school, they're practicing those techniques every day. And they become like riding a bicycle. You don't even know you're doing it. So we come up with strategies so it's just natural. And that, I think, those patient-centered techniques of listening, of empathy, of making sure the patients understand, and sharing in plans, opening a visit, just this simple process of opening a visit and making them feel welcome and safe at this visit. All those sorts of skills, I think, are the key and the gold behind.
So empathy, communication, and professionalism, kind of all together.
Yes.
And
those are the things patients remember.
Of course.
And we'll recommend another physician about, that they're going to remember those aspects, and not most patients, unless the patient is in the healthcare field, they may not know whether the physician has a very top knowledge or not, but they're going to know whether they felt cared for.
Right. So understanding the patient, where they're coming from, and listening to the patient. Looking back over your journey from high school to college to medical school to being a physician, educator, mentor, what advice would you give to students who dream of becoming physicians?
So I think it's repeating some of what we've talked about. It's being true to yourself. Don't go through it as a bunch of check box things to complete, but really do what is what you find satisfying. Do what you love, and if to be a physician, you do have to love the science of biomedical science.
Yes.
And you also have to love people and really enjoy working with people, and not just patients. You're working with patients, but you're also working with your team, and your team may include other physicians, but it may not. The team might be nurses, might be receptionists, might be many other different types of healthcare professionals. And so if you're working in the hospital, it's going to include social workers, it may include therapists of like physical therapy, occupational therapy, pharmacists, include so many different types of healthcare clinicians and providers that I think you have to love the biomedical science, and you have to love working with people and those relationships. And then if you enjoy those things, then hearkening back to what we've been talking about, is then just follow your path to it. Because if you enjoy those things, your path is gonna intersect with those sorts of things.
It's so great that you actually included not only working with people as patients, but as your support team. Because when you build good collaborations with your support team, the patient care improves significantly.
Absolutely.
Because as working in a hospital or any setting, as a matter of fact, you always have a medical assistant, a care manager, case manager, nursing staff, EKG tech. I mean, there's just no limit. there's just so many different types of people that we all work with.
And they all care for the patient.
And they all care for our same patient.
Yeah.
So having that camaraderie is so important.
Absolutely. And the receptionist too.
And the receptionist.
The receptionist is the first person and maybe the last person that the patient sees in the visit. And everyone is such an important part of the care team. And getting everyone aligned and working together is really improves care, just like you said.
Yes. Medicine is changing rapidly. There is AI, digital health. And as someone who has spent decades educating students, what skills do you believe today's students should begin developing?
I think they still should develop understanding why. They want to understand why the body works a certain way, why a patient is experiencing a certain symptom, or why maybe they hear a certain heart murmur or another physical exam finding. Really understanding why things are happening is an important skill set in being a physician always. And as we just talked about, the teamwork, the relationships, the relationships with your team members, the relationships with your patients, sharing, supporting, the communication skills, those are very important. And I think understanding your tools, like you brought up AI, and I think AI is a tool that can help in the care of patients, and it shouldn't be the care of the patient.
Right.
However, a physician, just like a physician uses a stethoscope, the stethoscope isn't making the decision.
Yes.
It's not making the diagnosis of the patient, but it's a tool a physician may use to assist in interpreting a patient's symptoms or a patient's diagnosis. And I think AI can be similarly a very helpful tool to aid physicians in piecing information together and understanding what's going on. But ultimately, it's a tool. It's not the caregiver.
Okay.
And so you're knowing how to use your tools. And so knowing the limits of what AI can do and not using it for things that are beyond those limits, and knowing what it can do, so you can use it as a tool, just like I can use a stethoscope as a tool.
So knowing your tools, knowing your skills, learning the skills, and still being able to determine and make your own decisions.
Yeah.
I'd love to end with one final question.
Okay.
If every high school student, pre-med student, medical student, or a young physician could remember just one lesson from our talk today, what do you think that would be?
I think do what you love doing and do it well.
Do what you love doing and do it well. And Dr. Weinstein, thank you so much for joining us today. I know our listeners will walk away today with practical advice. But more importantly, they'll leave encouraged to embrace curiosity, resilience, lifelong learning, and the human side of medicine. Thank you for sharing your experiences and wisdom with us. To everyone listening, I hope today's conversation reminds you that there is no single path to becoming a physician. Every journey is unique, but the qualities that sustain success, such as curiosity, perseverance, compassion, and a commitment to lifelong learning, are universal. Until next time, keep learning, keep growing, keep stepping it up. I am Dr. A, and I'll see you in the next episode. Thank you for listening to Step It Up with Dr. A. Remember, this podcast is designed to provide educational information and inspiration, not individualized professional advice. Always consult qualified professionals regarding your specific circumstances.